I'd like to share about 3 minutes of our time together to go over the prescriptive authority for Psychologists-Doctorates movement, both in Vermont and nationally. My name is Dr. Rick Barnett. I'm a licensed psychologist doctorate, licensed alcohol and drug counselor, and I have a master's degree in clinical psychopharmacology. The reason why this prescriptive authority movement for psychologist doctorates is so important basically boils down to 3 key factors: access, quality, and cost. So let's review access for a second. We all know that in underserved areas in Vermont, rural areas in Vermont, as well as populated areas of Vermont, it's very difficult to get an appointment with a psychiatrist or a psychiatric nurse practitioner with the skills and the ability to prescribe psychiatric medications. Oftentimes, Vermonters get their psychiatric medications from their primary care provider, whether it's a nurse practitioner, a physician assistant, or a physician in a medical home or a hospital, in those types of settings. While these providers can do a great job, they don't have the setting or the systems in place to be able to provide psychotherapy services in conjunction with their medication. Having a prescribing psychologist, either as part of a team in an integrated medical practice or in a private practice working with the primary care provider, really could save a lot of problems. We all know that medications alone can be effective, psychotherapy alone can be effective, and usually for some cases the combination of the two can be very effective. Being able to provide psychotherapy, psychotropic medication, either one or the other, in one provider as part of a team can be extremely helpful. Now, this has been taking place in Louisiana and New Mexico for over 10 years. Under the scrutiny of medicine, other providers are very pleased to have prescribing psychologists available for their patients. Prescribing psychologists often work in hospitals, rural mental health agencies, and rural settings. They have hospital privileges, they work well with other providers, and they become a valuable asset of the healthcare team. Now, in Iowa, Illinois, and Idaho, administrative rules are being written, and prescribing psychologists are beginning to prescribe in those states as well, in the same settings as part of a interdisciplinary team. It's a new day, I have a new shirt on and no hat, but I wanted to finish up by saying prescribing psychologists can reduce costs. We've reviewed access, we've reviewed quality, but prescribing psychologists can reduce costs in a number of ways. First of all, patients seeing multiple providers have to pay multiple copays, and there are multiple bills going to their insurance where they have to pay the deductible. Also, transportation to and from various appointments can cost the state as well as the individual a substantial amount of money. There are also other ways in which prescribing psychologists can save costs. We know that the combination of psychotherapy and psychiatric medications tends to improve outcomes in several patients. Prescribing psychologists see patients weekly, and with the added benefit of being able to manage medications, they can sometimes prevent costly emergency room episodes and reduce the need for multiple medications, sometimes called polypharmacy. It's also important to note that cost savings can come from a prescribing psychologist working with addictive disorders. With the opioid crisis, we know that polypharmacy can be a problem. We know that people with opioid addiction problems not only can abuse alcohol, other drugs, but also psychiatric medications. Having a prescribing psychologist to work with a patient weekly who may be taking methadone or buprenorphine or Vivitrol for their opioid addiction, they can also work with the patient on all the psychosocial issues that may go into why they became addicted and to prevent relapse, and also manage other medications more effectively. So to summarize, bringing prescribing psychologists to the state of Vermont will improve access to higher quality mental health care, will provide a framework for a more integrated and collaborative healthcare provider system, and reduce costs both in the ER, in terms of addiction, in terms of better management of psychotherapy and psychiatric medications, and it's a good thing for Vermonters. I really appreciate taking the time to share this information with you. Prescribing psychologists in the state of Vermont will improve access to needed mental health care, it will improve the quality of health care overall, and it will reduce costs. Thank you for supporting this initiative.